welcome back to the State of Healthcare podcast, or the SOH as we're calling it. Last season, we learned about things from the health provider's perspective. So we learned about our system and kind of some of the frustrations of why it's not necessarily broken, right? It's just doing what it says. We treat and treat. We don't necessarily try to prevent illnesses. We don't try to be proactive for patients. So unfortunately, what we've led to is a system that's not necessarily servicing or providing the actual care that it's supposed to be doing in the first place. This season, we're going along from the journey as the patient perspective. So I'd like to kind of combo. If you haven't listened to season 1, always go on back. But what we're going to be learning is what can you do as a patient? So here we're going to be exploring various conditions, some common, some not so common, and what the people have gone through on their journeys from here. So join us this season as we learn what you can do as a patient to take your own healthcare into your hands in the state of healthcare. Hi, and welcome to another episode of the State of Healthcare. I have Dusty with us, who, if you watched season 1, of course you did, was here talking about nutrition with us. But since this time we're talking about the patient experience, we brought her in to kind of go over struggles. It is be like, tell us about you having cancer. So, right? Like, how do you just go into that? So I'm going to kind of let you talk about your experience.
Sure. So, it was really, it's definitely a surreal experience for anybody who goes through it. But honestly, in my case, I had some symptoms leading up to, so I was diagnosed with cervical cancer in 2016. I was stage 2B, which basically means that it had grown large enough that it couldn't be operated on, but not so big that it had extended into any other organs or lymph nodes. So it was like not a later stage, but not an early enough stage that it was an easy fix. So still had to go through chemo, radiation, and some internal radiation. But basically for me, I started out with a lot of really intense symptoms, some that actually, I didn't put together as being anything to worry about. I started with a little bit of back pain, and I thought that I had just lifted something at work. I had a physical job, and I thought, oh, well, I just picked up something too heavy. I'm in my 30s. Now is time to start seeing a chiropractor. All of the, oh, my body is falling apart kind of mentality that we tend to have.
Right.
And so, I actually started seeing a chiropractor. And after a couple weeks, I said, my back doesn't really feel better. And I'm starting to have like cramps because my back hurts so much. And my chiropractor looked at me and he goes, your back is doing really well. He's like, I actually think you need to go see a regular doctor. And I did. I actually had an appointment scheduled at the same time after a couple appointments with a different doctor that really didn't pan out, and was actually a really good example of why you always need to advocate for yourself. If you feel like something is wrong and you're not getting any answers, it might be a good time to look for a second opinion. So that's what I did. I had an appointment with another doctor lined up, and I went to that, and my symptoms had actually gotten so bad, and my tumor had grown so large that they actually could see it. So I'm laying on the exam table, in all your glory with your feet up in stirrups, just like we women do. It's the best. It's the best. And I'm sitting there, and she goes, do you have any kids? And I was like, no, I don't have kids. She goes, your cervix is so large. It's like the size of someone who's had multiple children. And I said, well, that's not good. And she goes, I'm going to go get the doctor. You're bleeding quite a bit.
Well, and not to interrupt, but hadn't you also been having a 3-week period or something?
Yeah, I had this like ridiculous, like just 3-week long extended period. And then I think it was gone for about a week. And then it started again. And I was like, this is crap. And I had recently stopped taking birth control pills because, everybody's trying to get off of the birth control pills and artificial things. And I thought, oh, my hormones are just messed up. And that's what we do. We actually write off a lot of those symptoms because as women, we're given a lot of, well, that's just how it is, or hormones are weird, or that's pretty normal. Common is not the same as normal.
Right. And a lot of times people don't ask the period question.
They don't. And it was, no, I wasn't pregnant. And, at one point I was bleeding so much, I thought maybe I miscarried. Maybe I was pregnant. I miscarried because it was just getting to a point where it was like, this is not a normal period. I know we've all had like the weird ones that are not normal periods, but this was one that was like, I've never had anything like this, and this is concerning.
And not to like cycle out of it, but I've also heard even with COVID or with COVID vaccinations, a
Right.
lot of women have had a lot of changes in that area.
Yeah, I have heard a lot that it has changed some women's periods. So it's like we don't always know what's normal because normal is not normal.
Right. There's no like,
Yeah.
and a lot of times those concerns get dismissed.
Right. Well, and even, as a teenager, my normal cycle was, for most people, for most women, it's 28 days. For me, it was anywhere between 48 and 56.
Okay.
And that was my normal
right.
when my body was just doing its thing. So, you don't know what's when to say like, oh, maybe this is something I should get look at. So if you start having really strange symptoms and you're not getting any answers from your doctor, sometimes you need to go look for another one.
Doctor.
You should always advocate for yourself.
Right. Because again, what if you'd have just stayed with the first one?
Right. If I had stayed with that first one, I don't know how long it would have taken to get a diagnosis, because even when they came back with a transvaginal ultrasound that said that there was a possible mass on my cervix, when I asked her if she could see it, she said no.
Didn't she lose your results too?
She actually never took a pap smear.
Oh.
She thought she did, and she didn't.
Okay. So
yeah,
remember,
it was a hot mess. It was such a hot mess. And after like 2 or 3 appointments, I was like, I'm out of here. I was like, you don't know what you're doing.
Right. And not everybody will do that.
No. And some people will stick with their doctors. And unfortunately, I have talked to far too many women who, some of them aren't here anymore, who were diagnosed at a late stage, like stage 4B, because their doctors told them that they were too young to have cancer, or they were, there was nothing wrong, or this was normal, or the bleeding was normal, or they were just overreacting, or all of these things that you get told that you trust your doctor because you're supposed to trust your doctor. But sometimes if something is wrong, you've got to know when to push back. And some of them, unfortunately, were diagnosed too late for treatment to be successful. And some of them are not with us anymore. Well, and that's really unfortunate.
And I think I told you, and not to steal, but I had a patient at the same time.
Right.
Who wasn't telling me about her period. And I take responsibility that I didn't dig further. But I was sending her to the emergency room. She was in so much pain.
Right.
And ER doctors and all these other missed it until she basically, by the time they figured out it was cervical cancer, it had metastasized everywhere, and we lost her. And I felt responsible, but how are many other doctors? I was sending her off like, something's not right, this back pain should have resolved. These are symptoms that aren't like physical therapy.
And you're going, there's got to be something else wrong. But if you don't, I mean, obviously that's not your department. So it's like, if you don't know the questions to ask, then it's really hard to diagnose that, or even know what doctor to send her to. So I mean,
well, and as a PT, we do have screening questions we're supposed to do and things like that, and signs and symptoms for cancer. But then here I'm sending her off to these doctors.
Right. And they're not asking the questions.
And as a woman, she was like, oh, I didn't even think to tell them my period was doing all these things.
Doing something weird, because we're so used to it doing something weird,
or us getting blamed for it, or like drama. And you don't want to bring your period up, right?
Right. I mean, there are whole, not necessarily like diseases, but like whole, I don't know, like women who experience like painful sex, and that's just, it's a type of thing on its own. I mean, it's just, that is unfortunately a normal part of their lives, and doctors will tell you there's nothing wrong with that.
Right. And not think to go. Unfortunately, there are some gynecological pain specialists and some more resources out there. So.
Yes, but they're harder to find. There's fewer of them. So it's like, if your regular gynecologist is telling you, oh well, that's just normal, then you don't always know that you're supposed to dig deeper, but you should try to dig deeper, because it shouldn't always be painful, or you shouldn't have these massively long periods. You shouldn't be uncomfortable every day. Right. Like, those are not normal things. They might be common, but they're not normal.
So then talk me through, you went through the treatments, right?
Yeah. So I went through, I can't remember if it was 5 or 6 rounds of chemo, because it's been a while now, but it's somewhere in that. It was 1 round of chemo a week. And then while I was going through that, I was getting radiation at the same time. So I went through 25 rounds of external radiation. So like on a Monday, I would go in and I'd have my chemo, and I would say I'd go in, I'd have my round of radiation, which is like 10 minutes. You like lay on a table, you don't even feel anything. They shoot you with a bunch of radiation, and you get back up and you get dressed, and then I'd go upstairs and I'd have my chemo, and I'd fall asleep eating a sandwich. And in general, the treatment was not as bad as, like, I have a friend who went through breast cancer, and she got I don't remember the name of the one that they give them, but
Mm.
it's dubbed like the Red Devil, and
Oh.
it's it makes you super sick.
Uh-huh.
And fortunately, my particular experience was not that
Mhm.
I got very sick with my chemo. I didn't
Uh-huh.
have that. I didn't lose my hair. I remember one
Okay.
of my good friends was like, when I told her I had cancer, she's like, "Okay, that's it. When do we shave our heads?" And I was like,
Uh-huh.
"Oh, hold up there. We're not doing that for this." Uh,
Uh-huh.
so I
Right.
didn't lose my hair, but I would go every day. I went 5 days a week for radiation.
Uh-huh.
I would get, I'd drive out to Phoenix and I'd get this little 15-minute treatment, and then I'd
Mhm.
head back home. And honestly, it doesn't hurt. It doesn't do
Mhm.
anything, externally for me anyway. I didn't have any
Right.
like skin problems. I know that's
Okay.
common, but I didn't have any skin issues or anything, but it does definitely change your digestive tract. I mean,
Okay.
it's back and forth between like, sorry to get too much TMI for you guys, but this
But
is a health
it's
podcast,
the health
so you
podcast.
should be used to it. But with pelvic radiation, you can get
Uh-huh.
a lot of it goes back and forth between constipation and diarrhea.
Diarrhea.
And I mean, it
Mhm.
can be one day to the next. You're like, oh no, sorry, we're changing courses.
Right.
So
No.
it was definitely a wild ride.
Okay.
And then at the end of that, so I finished all of that, and you're
Uh-huh.
just completely exhausted from radiation, which compounds in your body as you're getting it. So it
Mhm.
actually builds up with each treatment. And I mean, you're just completely exhausted. There was a day where I
Mhm.
walked down my stairs to get a glass of water, and I was so, so tired that I actually had to stop and take a nap. And
Okay.
so before I could make my way back upstairs. So it really does
Mhm.
take
Just
all
drain
of your
you.
energy.
Mhm.
And then when I finished with that, I went through something called brachytherapy, which is specific to cervical cancer and a couple other
Mhm.
vaginal cancers. I believe they can also do it with prostate cancer,
Mhm.
which seems unfortunate. Um,
Okay.
but it's kind of hard to explain, but they take a bunch of different pieces. It's called a tandem and ovoid, which
Okay.
if you Google, you can find pictures of this, but it is not for the faint of heart.
Okay.
Um,
So Google only
yeah.
interface.
And they basically shove a bunch of stuff up through your cervix and into your uterus. And then once it's in there, they start connecting pieces. They go through multiple CT scans to make sure that they've got everything in the right place. You're
Uh-huh.
awake during all this, unfortunately.
Okay.
At least for me, some women are fortunate enough to get put under anesthesia. In my case, my doctor doesn't feel like it's safe enough to do that because you're doing so many treatments at once. We did 5 in a span of 2.5 weeks. So
Okay.
most doctors don't want to put you under that often. They don't want to do
Yeah,
they
that
don't
makes
want to
sense with
do
that
like,
anesthesia.
yeah,
Like,
and they don't want to do the, what is it for pregnant women when you the
oh, the epidural.
yeah, they don't want to do
Mhm.
epidurals that frequently either,
Yeah.
which can also cause their own issues.
Yeah.
Yeah, so they don't. So
Mhm.
yeah, it was just a handful of pain meds, which didn't do a whole lot for me. Some women have a better experience. I did not. Um, but once they get all that stuff in place through my multiple CT scans and small adjustments, then they hook you up to what is a high dose radiation. So
Okay.
because they can reach your cervix and they can see your tumor, they can actually direct radiation directly into it, which is a little bit different. When they do external radiation, what they're doing is it's kind of just hitting this large field of your body.
And hoping it gets it.
Yeah, and it's like
Mhm.
it gets the cancer, but it kind of gets everything else too. With this high dose radiation, it can go directly into your tumor because they've got those
Mhm.
pieces that are directing the radiation right to where they've put them. Since my tumor was not perfectly round, they
Mhm.
also use needles directly into my cervix to
Excellent.
direct the radiation, which is also fun to
That's
do.
so terrible.
It is certainly a horrific experience.
Although the prostate part sounds
Yeah,
really
that's why I'm
terrible.
like, "Oh god, they do this for." I've heard that they do this for prostate cancer too, and I'm like, "I cannot imagine. I don't even wanna know."
Sorry.
Sorry,
Yeah,
guys.
that's
So,
okay.
I don't know if that's common for prostate
Uh-huh.
cancer, but I have heard
Wow.
that it is
Okay.
a treatment, and I'm
Okay, an
like,
option.
"Oh, no
Uh-huh.
thanks."
Right? Okay.
Yeah, and then, they do this, it's about 10 minutes. They leave you alone in a room because it's very powerful radiation. Obviously, the docs and the
Mhm.
nurses don't need to be exposed to this any more than they might already be. So
Mhm.
they leave you alone in this room. It takes about 10 minutes, and then they go and they pull everything out, which unfortunately at this point might as well be razor blades.
Yeah,
So
also sucks.
yeah.
Okay.
And then it's after that you're free to go home. It's not a some
Mhm.
people do it where they do like a 36-hour or 48 hours where they're in the hospital and they're hooked up to the machine the entire time. So there's two
Oh,
different ways that they do it. Mine was 5 different
Okay.
treatments. There, some people do where it's one long one. I don't know if it depends on like where your tumor is or how your cervix is tilted or different things like
Okay.
that. But that was just the way that my doctor chose to do it. But
Okay.
so yeah, so it's definitely, I feel like I hear a lot of women who skip
Mhm.
their paps because nobody wants to go do this. It's an uncomfortable part of
Mhm.
being female.
Right.
Everything about it is, nobody looks forward to going and having their
I feel like
yearly
at this point there should have been a better method invented for
right.
so many things,
Yeah. Yeah.
but again, like mammograms, we've found out that aren't
Right.
as effective as like some of the other
Right. There
things.
are other ways that they can do that now that
Yeah.
are not as awful.
Yeah. And why are we still squishing our boobs?
Right.
But alas. So
Yeah, but unfortunately, pap smears and
mhm,
HPV testing are the two
mhm,
best ways to catch early
mhm.
cervical cancer. I was actually up to date with my pap smears,
Uh-huh.
but in my case, my cancer was growing higher than what they were testing for cells, which can happen in about 40% of cases, is what my doctor told me.
Okay.
Um, so HPV testing is actually a really good way.
40% of cases? Holy
40%,
shit.
yeah. So
Okay.
unfortunately, it doesn't always grow. Your cancer cells don't always grow in the area that they're taking the scraping. So
Okay.
sometimes that's what
Uh-huh.
happens.
Okay.
But HPV testing is actually a really good way to,
Mhm.
if you have active HPV, and there are, God, I think there were up to like 70 or 80 different types. I
Mhm.
know that there's a ton of types. There are a handful that will
Uh-huh.
cause cancer if they create these abnormal cells and are left to grow on their own.
Right.
So, with the HPV testing, if they can
Mhm.
tell you that you have active HPV, then
Mhm.
they know to look out for those things.
So they can monitor it
Right.
better.
Which, and I know that the standards have changed
Mhm.
since I was diagnosed. So I was diagnosed back in 2016. I was 32 at the time. Um, in
Mhm.
my case, they do not HPV test you unless you had abnormal cells, which I never had. So,
Mhm.
or if you were over 30, which, because there's, I think, about 3 years that you're safe to go in between PAPs. I was only 2 years in, and
And
I
the
had had
next
one.
year.
My
Mhm.
first, my last PAP had been at 29, so
Mhm.
they were only HPV testing if you were 30 or older. And I
Okay.
was not at my last PAP. I was 29, so I did not
Mhm.
get an HPV test. And it is not part of your STD panel, which I always got STD panels done when I went in
Mhm.
just because I wanted to be safe. I was not. I had only gotten together with my husband a little while before that, so
Mhm.
we were still just being careful, and I had always
Mhm.
gotten checked, but did not know that that was not part of an STD panel.
Okay.
So I had never been told that I had HPV.
Mhm.
I never had abnormal cells. So it was kind of a surprise to hear that I had
Right.
cancer.
Right.
However, it was a little bit of a relief because I had all of those crazy symptoms. And honestly, when I wasn't
Mhm.
getting answers from my first doctor, I was almost more afraid that they were going to find nothing and
Mhm.
that I was just going to be stuck living like this until
Mhm.
something changed.
Right. Okay.
So when my second doctor actually did the exam and looks and very surprisingly goes, "Oh, that looks like cancer."
Uh-huh.
It was actually kind of a relief because I was like, "Oh, thank God, at least we know what to do with this."
Right. Versus just running around with
Right.
this uncontrolled
Versus,
back pain that
I
you
don't
had no
know why
idea.
you're bleeding. I don't know why it hurts. That's weird.
Uh-huh.
So it was nice to have an answer, even if the answer is something that, is not ideal.
Mhm.
But um for the stage that I was at, it has, I think,
Mhm.
an 80% survival rate,
Okay.
and I am past my 5-year mark. So,
Yay. Uh-huh.
you know, uh it looks good. I mean, there's always a chance that things can come
Mhm.
back. You never have that solid peace of mind, but I am not a person who can spend all my time focusing on that. I
Mhm.
if I can't see like spending all my time being afraid to live because I
Mhm.
might die. That
Right.
seems to defeat the purpose.
Yeah, and then I know there's always like the mental component of the things,
Right.
right? So the more
Yeah.
you're like, oh, I have cancer on this thing, and I'm not saying that fixes everything, right? It's
No,
just,
but I mean, it's like, definitely your mindset changes things. Like,
mm,
I think there's actually research that shows that going into things like that with a
mm,
positive mindset tends to yield better results. I mean, it
mm,
doesn't mean that it's going to fix everything. Obviously, that's not how it works, but
right.
I think it changes the way that you respond to things.
Uh-huh.
So, I mean, it definitely did help to and I'm still scared. It doesn't mean that you're not scared.
Mm-hmm.
It just means that you can't wake up every day going, "Oh my God, I'm going to die from this."
Right.
Like I still tried to go and do things. I
Mm-hmm.
I remember trying to go to a food festival with you. Did
I know,
not make it.
sorry.
We
I'm
didn't make it, but we tried. We were still trying to live our best lives. Um,
and that's the hardest part is like, I know it's
yeah.
like you're there and you're like, no one else can be going through this, but I still feel like you were pretty positive through the whole
Yeah,
way.
I definitely was. I mean,
Mhm.
because I think I remember having a friend who was going through at the
Uh,
time she was going through a divorce and her life was not the way she pictured it. Things were really rough for
mhm,
her and she said, "I'm afraid to talk to you about it because I
mhm,
don't, I don't want you to think that I'm trying to,
mhm.
overshadow anything or that I don't care about you." And I said, "No, no, I want you to still talk to me about this because
Right.
we can both be going through things. It doesn't mean that
Mhm.
what I'm going through isn't still hard." I was like, but everybody has something going on right now. I was
Right.
like, so I want you to be able to come to me with stuff that's going on in your life.
Yeah.
Like, and we did. We really got to help each other through like these two
Both ways.
terrible points of our life because it's somebody's always going to have it worse than you. It doesn't really
Uh-huh.
do any good to go, oh, well, I shouldn't complain about this because my friend has
Mhm.
cancer. And it's like, yeah, everybody's a little different. Maybe they don't have the mental capacity to talk to you about it right now, but it's okay to ask, like,
Right.
and for her, I mean, she wanted to make sure that she wasn't, giving me too much to handle, but it was
Mhm.
actually kind of nice to be able to help her
Right.
through
Focus
something while
on
she was
something
helping
else.
me. Yeah.
Long-term results. So you've had all
Mhm.
this radiation and things. Are
Right.
there like what
So
happened?
there is a lifetime limit. Now, I don't
Mhm.
actually know if I've hit my lifetime limit. I haven't been
Mhm.
told that I have, but there is
Okay.
actually a lifetime limit of
Mhm.
radiation that you can have. Um, yeah, where
Mhm.
that's it. You can't get any more before
Right.
it starts to become something that changes into like causing more cancer.
Okay.
Um, for me, because of the pelvic radiation,
Uh-huh.
I do have small spots that grow in my bladder that are
Okay.
precancerous. So there's a
Mhm.
difference between, I know there's a lot of women that get diagnosed with cervical cancer or their
Mhm.
doctors tell them they have cervical cancer. And a lot of times what they have is precancerous cells that are non-invasive.
Okay.
So it's those cells, if left alone and left to grow, will
Turn into.
become invasive cancer, but
Okay.
at that stage are not invasive cancer. So it's not the same thing as like going through treatment for cervical cancer.
Okay.
You know, I hear that a lot, and it's like I remember saying to my neighbor that I was a cervical cancer survivor, and she was, "Oh, me too. Yeah, I had one of those procedures where they just cut it out."
Take
And I
it
was like,
out. It's not
"Yeah." I
the
was like,
same,
and
but
and that is a valid and scary thing to go through, but
mhm.
it's definitely not the same as invasive cancer and going through that treatment or even
Mhm.
having a hysterectomy where they're taking out not just
Mhm.
so the hysterectomies for cervical cancer tend to be different because they have to take some of the surrounding tissue
Oh.
um, because
Mhm.
they want to make sure that they get all of those
That
stray
it
cells.
didn't
hmm
metastasize anywhere else.
Yeah, they want to make sure that your
Mhm.
chances of recurrence are as low as possible.
Okay.
So it's a little bit different.
Interesting.
They do take more
Mhm.
tissue than what they would take in a regular hysterectomy for somebody who's just like, I'm done having babies or I'm
Of
done,
course.
with my period and I want this
Mhm.
thing out of me. It's a little bit different for cervical cancer because they do have to take so much tissue around it. Sometimes
Mhm.
women experience like nerve damage in their
Mhm.
thighs or in different
Okay.
parts of their abdomen because of how much they have to remove versus a regular hysterectomy where they're
Mhm.
just taking the organs.
Okay.
Yes, there are some differences there.
Well, so how often do you have to have like those screens where they look for that stuff in there?
So, for the bladder, okay,
Mhm.
so for those, I am now down to once a year,
Nice. Okay.
because we haven't found any new spots in quite some time. So that's
Nice.
always it's always promising.
Right.
So in the beginning, he wanted to do them I
Mhm.
think it was like every 3 months. I was going in and
Okay.
just checking for spots, having spots biopsied, having them cut
Mhm.
out, so that if they were not so that they weren't left to grow. And
Okay.
once we got to a point where he wasn't seeing them at all, we've been able to push it out further and further so that with this last one that I had January of
Mhm.
2022 or sorry 2023,
Okay.
um, he said, we haven't found any in a while. I think we're safe to go to a year. So I'm actually due for my
That's
next
what I was
one.
like. That's
Yeah.
gotta be coming up.
We're switching
I'm so sorry.
insurances. There's been some like
Okay.
mishaps with the insurance company. So I'm
Right.
waiting for my
So
new insurance to be
soon.
active. But
Okay.
yeah, so I'm
Mhm.
actually due for my next one, which honestly, I think it'll probably come back good.
Okay.
Everything
You'll
feels
be
good. Nothing no new weird symptoms. So
well. And then just to touch on
mhm.
insurance, didn't you have
Yeah.
to fight
Oh
with
my God.
them on
Insurance.
everything?
Well, insurance was a
Mhm.
nightmare. And then also, so was the cancer center at some point.
Mhm.
So the first part of it was We had just gotten this new insurance. I was incredibly lucky that we got our new insurance right at the time where I was getting diagnosed, but I hadn't met any part of our deductible yet. And we had, I
Mhm.
think it was a $6,500 deductible. And so
Okay.
this was 2 days after my diagnosis. I
Uh-huh.
was going in for my PET scan. I had seen that second doctor on Monday.
Uh-huh.
She said, that looks like cancer. You're going to see an oncologist tomorrow. So I saw my oncologist on Tuesday. The
Uh-huh.
oncologist said, yep, I'm pretty sure that's cancer. I'm not even waiting for the biopsies to come back. You're having a PET scan Thursday. So this was all moving really fast.
Mhm.
So Thursday morning, I'm walking into the cancer center and I'm like, okay, I'm checking in for my PET scan. And she goes, okay, well, it looks like you haven't met your deductible yet. So that'll be $5,000. And then she looked at me and I looked at her and I was like, oh, I don't have $5,000.
Right. You're like, "Look, I just have cancer right
Yeah.
now."
I was like, oh, do I look like I have $5,000? She goes, well, is there anyone you could call? And I'm like, not that has $5,000.
Also a giant like
Yeah.
WTF moment.
Yeah. Like what?
Thanks, Cancer Center. So
So
great that your doctor moved
right.
fast, but like what the
Right. But oh my God. And
Mhm.
so she, she's going, oh, well, is there anyone you can call? Do you have a credit
I
card?
like
Do
how
you have
she did phone a friend.
Yeah, seriously. Like, hey Tracy, can I just borrow 5 grand?
I
You've
mean, if
been
I
sitting
had five
around.
grand for your PET scan, I'd totally come get you.
She let me say, so at this point, all I know is I have cancer and I don't know where it is. I mean, I don't know how much I have. It could be growing anywhere
And
at
I
this
can't
point,
pay for the
and I
shit that
can't pay
will.
for this thing.
Mhm.
And so I'm freaking out. I'm bawling.
Mhm.
She's letting me sit there just having this panic attack. And finally she goes, well, we could set up a payment plan. How much can you pay today?
Oh my
So
god.
we got
Maybe
past
open
that.
the check.
Yeah, exactly. So we got past that,
Uh-huh.
but then literally every step of the way was just a fight with the insurance company.
Mhm.
And then at the end, so I didn't have any surgery. I just
Mhm.
had chemo radiation, and there's no way to tell if any of it worked aside from
Mhm.
doing another scan.
Of
So
course.
my doctor says, okay, I'm ready to do your PET scan to see
This
how
was
treatment worked.
successful.
Yeah, like I'd
Mhm.
like to know if I still have cancer. Everybody wants to know.
Uh-huh.
Um, and the insurance company goes, oh, we don't think that that's medically necessary. We checked with our oncologist and you don't need one. And I'm
Okay.
thinking, well, that's interesting because my oncologist who actually treated me does think I need one.
Mhm.
So, yeah, so they actually pay people to deny claims
Mhm.
um, as often as they can. And if this happens to you, if this is something that you go through,
Mhm.
your doctor can actually fight back for
Like a
that.
peer
And
to peer kind of thing,
yeah, they
right?
can do a peer to
Mhm.
peer and they can explain why this is medically necessary and
Mhm.
why they think that you need this. And
Uh-huh.
and most of the time, that is enough to get it approved. In my case, it actually was, I think that they did approve it.
Uh-huh.
Um, they approved one, and then that one came back not
Mhm.
completely clear. So the thing with radiation is it stays in your body for a while. So
Okay.
I had this scan 3 months after I finished treatment, but
Okay.
there was still like residual radiation hanging
Oh.
out in that
Mhm.
area. So some things still lit up, and she said, I'd really like to see what it looks like at 6 months, just to
Okay.
make sure that everything worked.
Uh-huh.
So we did actually have to fight for that second scan, which I think ultimately they denied.
Mhm.
Um, and I think I had to wait until I started
Mhm.
the new year and
Oh,
then could
okay.
do it again where I had to
Uh-huh.
pay out of pocket for another
Five
scan and
thousand dollars. So a
like
couple lessons. One,
yeah.
if you are in healthcare, be kind when you're delivering messages,
Right.
especially for like at front desk. Like really, like
Right. I mean, it's like
you work in a cancer
yeah,
center.
this was a cancer center where literally every
Mhm.
person coming to you has been diagnosed with cancer. And it's like to just sit there and
Uh-huh.
let somebody panic
To
thinking,
you,
oh
it's a
my
job.
God,
To this
yeah.
person, it's their life.
And I'm just like, every person you talk to
Mhm.
has cancer. How can you be this
Be this
cold?
callous, and I
Yeah.
get you're probably dealing with a lot. And then the
Right.
other part is the irony of radiation is the cure almost becomes
Right. It does
the thing.
unfortunately sometimes cause more problems.
Mhm.
I know for a lot of I know for a lot of people they're fine. Like they go on and they live their lives just fine.
Mhm.
And honestly, aside from the tiny spots that grow in my bladder, I am fine. I do not
Mhm.
have long-lasting damage for a lot of things. There
Mhm.
is one small one that I'll talk about, um,
Uh-huh.
but like a lot of women do have digestive issues that
Okay.
proceed for years. I mean, I
Uh-huh.
know some women that unfortunately are left wearing adult diapers
Okay.
because
Mhm.
they don't have the control over their bowels that they used to because of
Mhm.
the radiation. Um, there are some cases where you might have to have further surgery, and unfortunately they have to remove
Uh-huh.
more organs than they planned on because radiation can fuse all of your organs together, which is another fun thing.
Okay.
And then there is my case, which for me, what happened is because of that high dose radiation, there was basically my vaginal canal weakened and collapsed on itself and has fused together. So what's left of the vaginal canal is about 2 inches, maybe.
Okay.
So it's and I've talked to doctors about it.
Mm-hmm.
Um, they can
Mm-hmm.
do surgery. Well, actually, I have one doctor that said he can do surgery, but he
Mm-hmm.
highly recommends not doing it unless it is medically necessary because
Mm-hmm.
radiated tissue doesn't heal the same way.
Okay.
There's a high chance of puncturing bladder, puncturing bowels,
Uh,
and that leads to way more issues than that you
right.
don't want to
Going
live
in
with.
for in the first place.
So it is an interesting thing that we've learned to live with.
Uh-huh.
Like my husband and I have learned how to deal with that. It's not ideal, and it's very different,
Uh-huh.
but at the same time, I could have died. So,
Oh, you're
it's
still
it's a
here.
trade-off.
Right.
And it doesn't mean that you're supposed to just be like grateful that you're left with this like
Mm-hmm.
scarred body, because I think that's kind of the idea, is that because you survived cancer, you should just be grateful.
Right.
Like you should just be so happy that you survived. But sometimes it's okay to
It's okay to be
be,
mad with the
yeah,
residual shit that you're left with.
exactly. Like it's okay to
Mm-hmm.
be angry that like
Mm-hmm.
this normal is not the normal that you had before.
Mm-hmm.
Like it's okay
Mm-hmm.
to be upset about that.
Right.
You shouldn't, you should find a way to deal with it so that you don't have to live with that, because
Right.
that's not a good thing to carry around forever.
Right.
But
But you do get a right to be mad about it
you absolutely do, because
and then
yeah,
figure
it's
a way.
not, because none of this is
Mm-hmm.
fair. Like
Right.
none of it's fair. Nobody should have to go through that. Nobody should be
Uh-huh.
left with these things. But that is the unfortunate part of life, is that
Mm-hmm.
I think it's, God, what do they say? Like 1 in 6 people gets cancer.
Yeah.
Is it
It's
even that?
probably
I
higher
was gonna
now,
say
I
it
would
might even be
assume.
more.
Yeah.
So it's like, it's
Mm-hmm.
unfortunate, but yeah, I know there are two of us in our group of five that I grew up with that have already been diagnosed with different types of cancer. So,
Oh, well.
and we're only
Mhm.
40. So
Right.
yeah, it's definitely becoming more common.
So again, we're gonna kind of finish up with some life
Yeah,
lessons with patients. So
right.
fight for your healthcare.
Fight for
So
your healthcare.
I mean, I've had other. I
Yeah,
did an interview with another person with their cancer. They actually ended up paying, like, because the insurance kept
really.
denying, and
Oh
they
my
had to
God.
pay for the scans out of pocket.
That's insane.
And by the time they had
Yeah,
already had the scan by the
yeah,
time the insurance denial letter came.
yeah.
And so
It's
fight for
like,
your health care.
yeah, and
If
that's the
you're
thing. If something's wrong, push.
if your
Yeah,
doctor isn't addressing your concerns,
right.
or they're
Absolutely.
just blowing you off, especially as a female,
Mm-hmm.
like, not, or just even like women in our periods and our
Right.
things, like,
Yeah,
fight for that, because
absolutely.
there's no normal.
There is not. Yeah, everybody,
Um,
it's such an interesting thing, the way that hormones are, the way that our
mhm,
bodies are. So
mhm,
it can be hard to know when something is wrong, but you know your body better than someone who just met you. So
right.
if you feel like something isn't right, you should push.
Any last piece of advice on the
Um,
things or what you learned from your
right.
journey?
I mean, I know that going and getting pap smear is not high on anybody's list, but it's always good to
Mhm,
stay current with those. I know that in my case, it wasn't necessarily the
uh-huh.
defining factor, but it still catches a lot more than it misses. So it's still something to keep up on.
And then maybe
Yeah.
even bringing up HPV testing
Yeah,
for
HPV,
someone.
which is becoming more, I think that they've changed the regulations on that. I'm
Okay.
not as up to date because mine's a little different at this
Yeah.
point, but yeah, getting HPV testing,
Uh-huh.
understanding what that means. You can't clear the virus, but you can um, have it be dormant by keeping a good immune system, by not
Mhm.
smoking, by just like, eating healthy,
Mhm.
trying to maintain a healthy body weight. All of those things can help,
And
keep
then
those,
just being
yeah.
aware. So if you do have those precancerous
Right.
cells, getting that removed and
Yes.
keeping an eye
And
on it.
if you are diagnosed with something like precancerous cells, going in for those follow-ups. I
Mhm.
know a lot of women get really scared. They don't want to go back. They're afraid of the procedures,
Mhm.
but those
Mhm.
things are more helpful than they are hurtful. So
Right.
definitely good to follow up on those if for some reason you do end up in that position where you're being told you need to come back for further treatment.
Well,
Yeah.
I personally am grateful that you survived, and
Me
I
too.
know that you still have to go through the things, and I am sorry about.
But you know what? It's getting better as time goes by. I mean, like
Mhm.
I said, I'm coming up on, this summer will be 8 years out from treatment.
Oh,
So
okay.
I mean, it's definitely, we do some crazy things. So I feel like
Mhm.
my life is not heavily impacted by the fact that I went through this at one point in my life.
Right.
There's still a lot of stuff that I can do.
You still got a lot of things to do. So,
Yes, absolutely.
So keep tuning in. And
Yes.
again, thank you for coming back and sharing your patient
Absolutely.
journey.
I'm happy to be here.
All right. Bye.
Thanks, guys.
Thank you for tuning in to today's episode of the State of Healthcare podcast. We hope that we were able to gain some valuable information or at least some insight into what goes into some of these conditions from this patient's story. Again, please feel free to like, always share, please follow us online at Better Fit Therapy. And again, if there's any conditions or things that we haven't addressed or that you might find interesting, you can always message us online and we'll be willing to investigate. But again, taking your own healthcare into your hands is probably the most important lesson that you can learn from this. So unfortunately, in the state of healthcare that we're in now, you do have to fight for the things that are important. We encourage you to take a more active role in your healthcare and be able to participate so that we can fix this system where we're at now. Thank you again and have a good day.